Hi, everybody. It's Dr. Laura Bush again with Becky Norwood. Bookie Norwood. And Karen, I am so sorry I blocked out your last name. Karen Kermack. Yes, Karen Kermack, who is the mother of one of Meina's patients. And we'll be talking today about the topic of when nurses and their patients become closer than they might normally be, to keep that professional distance, how and why that happens, and the result of that, both negative and positive sometimes, because of course, when you become close to a patient, then you're involved in their emotional journey even more, and other kinds of impacts of that. But I wanted to announce that today, the Pima Medical Institute bought 50 books of Meina's for their nursing students. And Pima Medical Institute in Arizona is one of the largest nursing schools in the state. And we are so excited about that purchase. They're going to give them to their senior nurses and pilot that as a book that they can use to train nurses who are about to be working with the kinds of patients that Meina works with. And so we're thrilled that Pima would do such a thing and that they would get the value of this book. I also wanted to mention, you've looked at the front of the book. Backs of books are very, very important for those of you who buy books, and I know this is backwards, so you can't read this, but we call this the back cover copy. Here's the author information. So when you make a decision to purchase a book, there are a number of things that you really look at. You look at the cover, you look at the title. It's just like any other product. So you as authors or you as purchasers of books know that the cover of a book actually really does matter. And Melinda Tipton Martin designed this book. She did a beautiful job. She is a book designer and very, very skilled at it, both the interior and the exterior, and both matter and both make a difference for the professional quality of an independently published book. And we're so grateful for the work that she's done to take Meina's vision for her book to reality and what it looks like. But she has designed this back cover. Another thing that makes a difference for whether people want to buy your book or not is based on endorsements or testimonials. Meina sent this book to people that she knew would be interested in it to ask for their opinions and if they would be willing to review it, and they have. And those are called endorsements, and she has quite a few of those throughout the medical community and new nurses as well. And so I wanted Becky Norwood, who's a professional book marketing expert and launching expert, just to talk a little bit about the value of reviews before we get into the conversation with Meina and Karen very, very briefly.
Some of the best things that can happen to an author is the review process. And Amazon has a wonderful platform that right below, right on the same page the book is sold, is you're given an opportunity to give a review. And in our world today, with everything so online, we're able to check out grocery stores. We're able to check out, just about every platform any place that we're going to purchase something, we can read the reviews first. And that oftentimes will make a decision as to whether we're going to actually make that purchase. So with as many readers that have picked up Meina's book, we ask that you give a review. You take the time and go back into Amazon and give a review. It's highly important. Another good place is to go over to Goodreads, because her book will also be posted in Goodreads, and one of the place or the other to give a review, because that lends credibility that often colors the decision-making process of somebody that's considering, is this something that I want to spend money on? Do I actually want to read this book? And so Meina's process and her purpose behind writing this book is to reach the new nurses that are just coming into this field and starting to fill the roles of women like Meina who have come to the place in their life where they're pursuing other activities and going on, being grandma and all the other good things that have. And the value of their years of experience is what she's sharing in her book. And so for the young ones that haven't yet had a chance to form the bonds and the roles, as Meina and I'm sorry, my names, you'll hear Karen, you'll hear the stories of how they do oftentimes will form bonds with patients, but the stories that are in Meina's book are going to impact you and be a very vital source. And that's why reviews are so very important.
Yes, and we thank you for any of you who would be willing to review Meina's book and give her and others the kind of feedback that they need to make their decision about whether to buy or not, and the value of the content. So with that, I want to just have Meina introduce Karen and talk about the patient-nurse relationship and what happens when you become especially close in these types of circumstances. So Meina, take it away.
Thank you. Thank you, Laura. Thank you, Becky. This is Karen. Karen is a dear friend, and that friendship was formed by a connection that we both had with an amazing young girl. And Karen's daughter, Kim, I met her when she was 18 years old, and that would have been 14 years ago. Yeah, 14 years ago when we met. And Kim was diagnosed with a very aggressive brain tumor, and her prognosis was not very favorable. And it was thought with the neurosurgeons and as well as the other medical staff that Kim perhaps had maybe a year. And the good news is that we never told Kim, right?
No, it was hard. I had my stepsister, Jerry, and Meina and I, we were the only ones other than the rest of the nursing team that knew exactly how sick Kim was. Kim was just turning 18, her whole life ahead of her and all this other sorts of stuff. I didn't want a chance of Kim knowing how sick she was because I was fearful that she would just give up. Mm-hmm. So I never told my husband, I never told my other children, I never told anybody that might somehow mistakenly mention it to Kim. Mm-hmm. So it was a secret that and I think that also strengthened our bond between myself and Meina because I could trust her. I knew that, she wasn't going to say anything and stuff like that. I also knew that because my daughter was 18 at that point, that what I was doing was wrong because she should have actually have known exactly how sick she was. But like I say, as the parent, and the start of Meina and I meeting each other, Kim, when she was 9, she woke up one morning. Well, actually, she didn't wake up one morning. She was having status seizures that put her into, well, it's the first time that she was on air ambulance on STARS, sent her to the Children's Hospital. When Kim was 12, she had her left temporal lobe removed to control seizures because she had uncontrolled seizure disorder. Even with medications, 14 to 20 seizures a day.
Wow.
And she kept regressing and stuff like that. So anyway, after the surgery, she was seizure free. And then it came when she was 18, she was driving one day and she went to pass a vehicle and she cut someone off and she did not see them. And I realized at that point, she was telling me that she couldn't see out her left side very well. So I took her into the doctor. And the doctor then immediately sent her into Calgary to ophthalmologist to get it checked out, which turned around and sent her to the Foothills. I was on my way back from Lethbridge at that point, and I get a phone call, and all I hear is, Kim's got cancer. And I was somewhere around Claresholm. I do not remember the rest of the drive into the Foothills Hospital. It was like I was just zombified, just absolutely numb, in disbelief, in fear. How can it happen to my daughter? And stuff like that. So after Kim was at the foothills there for a bit, then we ended up going through the Baker, and that's where I ended up meeting Meina.
Mm-hmm.
Meina was one of the oncology nurses that come in, and her, starched white jacket type thing, and very professional, and and stuff like that. And there's somehow a connection between Kim, I noticed, and Meina, because Kim was very introverted. She had issues, like say with seizures before. She had issues with her speech when she was younger and stuff. So she was very introverted, but she made this connection with Meina. And anyway, we ended up when Dr. Hussein went and told us there, it was the beginning of December, he went and told us, he says to Kim, he says, "You've got cancer. Go home, have a great Christmas." And all that I could think about at that point was, this is probably going to be my last Christmas with my daughter. So as it was, we made it through Christmas, everything was fine and stuff like that. And starting in January, the first day of radiation treatments, because Kim had to have radiation treatments, first day of radiation treatments, I was actually having surgery in Lethbridge. So my husband brought her in on the first day, and it was actually, I came in for the second day, and Kim's third day of radiation treatments, she woke up the next morning and she was blind. She couldn't see anything, couldn't see light, couldn't see anything. Now, here's a kid, who's been told that she's got cancer. Now she ended up, losing her vision. She got put onto steroids to control the swelling in her brain, Decadron, which she called the drug from hell. It caused Kim to gain over 80 pounds in a couple of weeks.
Oh my goodness.
Her hair fell out. She couldn't see. She looked like the Michelin Man type thing. And here, beforehand, she was 5'8", about 130 pounds, 135 pounds. And then she went up to almost 300 pounds.
Oh, wow.
And, but, I think in a sense that it was God's grace that Kim was blind, because if she would have seen the way that she looked, she would have given up.
Mm-hmm.
But at one point there, while we were staying at my stepsister's place in Calgary, she was gracious enough to let us stay there during the week for treatments and stuff, so we didn't have to do the 2 hours back and forth each day. She got up and she found that she couldn't stand. I don't know if it was because of, the Decadron weakening the muscles and stuff like that, but she couldn't stand. She couldn't move her arms very well to feed herself. And she says, "Mom, I'm just a slug. I just want to die."
Mm-hmm.
And here I am, I'd already gone over all the medical papers, the AISH and the prognosis being grim and all this other sorts of stuff. And I'm like, "You're going to be fine. Everything's going to be fine." And, that was, well, actually during the treatments and stuff like that, we went through, somebody suggested that we go through the Children's Wish Foundation. And I knew that Kim was 18, so I wasn't too sure whether or not, because they grant wishes for up to 17, and Kim being 18. But they made an exception because Kim, with her seizures and her surgery when she was 12, they decided that it would be okay. And not only did they just supply it for Kim and myself, but they supplied a 10-day Caribbean cruise for the whole family. Plus, they suggested that we have a nurse with us, because being out in the Caribbean, it's better to have a nurse and not need her than need a nurse and not have her. So that's when we went and asked Meina one day. She come on into the office and stuff like that, and we were talking. And I asked Meina, I said, "Would you like to, go on a cruise with us?" And Meina's jaw must have dropped down to her knees. Huh? And I said to her, "You seem like nobody's ever asked you this before." And Meina said,
Well, because of the population we have, we don't usually have a whole lot of children. If they do come in for treatments, they go back to the children's hospital. So this was to have Kim granted a wish as an adult, I mean, that's not usual. And then to have the neurosurgeon suggest that a nurse accompany her, that's not an opportunity that comes along usually to our staff in our center. So I checked all the logistics and everything else, and I was supported to go. And that's when I officially stepped on to the Kermax dance floor. And before that, yes, Kim was incredible and funny and joking and this sort of stuff. And there was a connection there. But now I was connected with the entire family. I mean, 10 days with people that I didn't really know personally. They didn't know me. And all of a sudden, at the airport, they're meeting my husband and he's meeting them. And it just completely changed the dynamics just like that. And the 10 days was amazing. And even though I had perhaps some reservations about what would it be like for 10 days to be with a family that I don't know, it was an incredible experience. It really was. I got to know them at a level that had me see how they lived life and how they interact with each other and how they interact with others like myself. And I was totally absorbed into their family unit. And it was an incredible experience. When we returned from the cruise, we continued our connection. My husband and I would drive out to your place out in the country, and I'm not much of country life, but anyways, I would go out there and look at the sheep and everything and nod, as and they would come into town and we would meet for dinner or lunch or whatever, and the connection continued. Now we're fast forwarding 7 years later. Kim is still living an amazingly powerful life.
Wow.
I mean, beyond expectation. 7 years. And we had made a plan that Kim was going to go down to Phoenix. My husband and I spend winters in Phoenix. And we had made a plan for Kim to come down. She wanted nothing more than to go on a vacation unaccompanied, and she was going to do it. And we said, okay, we'll support you. We got everything in order, paperwork, insurance, everything else, right? And about 4 days before she was ready to leave.
It was actually the end of November.
Right.
And actually it was the 24th of November. It was the day after her older sister's birthday.
Okay.
And she's sitting in the living room, and my youngest kid come on up, and she just starts screaming, "Mom!" And it's like, like what? So I come on out, and there's Kim having a seizure. This was 7 years. And all I could think of was, oh, blank, here we go again. So we went into, called an ambulance, and we went into town. They sent her into Calgary and stuff like that. They did another CT on her to find out that she had 4 more tumors. Mm-hmm. So now here's Kim, who the whole time, for 6.5 years, because she lived 7, so for 6.5 years, mm-hmm. other than the time that she said that she was a slug, never once did she say, why me? She was always, okay, well, thousands of people are blind. I'm not going to use that as a crutch. I'm still here. And she knew how to live the moment. She used to say, Mom, don't sweat the small shit. If you're not going to worry about a year from now, why are you worrying about it now? Mm-hmm. And she was just, she was the most amazing, upbeat young person. I mean, she taught me more about how to live than what I could have possibly have taught her. And so anyways, we went into the hospital there with her, like after she'd had her seizure, and the neurosurgeon, checked her out and stuff like that. And Kim says, well, I'm going to Phoenix. And the neurosurgeon said, no, you're not. And she says, yes, I am. I'm going to Phoenix. And he said, no. So anyways, at the end of the appointment, we got into the car and Kim cried all the way home. I mean, we had gone on holidays, you know, where she had been, you know, accompanied by either her sister or myself or Meina or, you know, whatever type thing, but she had never gone anywhere by herself. And this was going to be her trip. We had it booked from the 1st until the 8th of December for her to go down to Meina's place. And like I say, that she cried all the way home. And that night she wanted to give up. She was just crying so hard. And I phoned up Meina and I talked to her, and Meina and I both decided at that point that we were sending Kim down to Meina. And if Kim died, she was going to die her way. And it was hard, you know, but all I had to worry about was the time that Kim was on the plane, going down and coming back, because I knew that she was in good hands. I mean, Meina was one from the very beginning. I think one of the reasons why I attached myself to Meina was, first of all, out of fear. You know, I was terrified. And if I had somebody who knew, you know, what was going on that could help me to be able to better understand, you know, what was going on with Kim. And that's what kind of started. And then Meina has this wonderful, bubbly personality, you know, and stuff. And she, and I know, you know, from being in the medical field also, that, you know, you have that wall that you're supposed to put up. But sometimes, you know, that wall just comes down.
You bet.
And, you know, even after like, well, Kim, she went down to Meina's. She had a wonderful time. And when she came back in, because her surgery was scheduled for the 12th of December. And when she went in and she was getting ready to go in for her surgery, she looked at the neurosurgeon and stuff like that, because he come on up. And first thing that she said to him was, "I did so go." You know, I mean, like she just had this way about, you know, sometimes she could just be almost snotty type thing. But, you know, just to prove her, you know, if you told Kim that she couldn't do something, she would do it. If you told Kim that there's only a 2% chance that this or this or this, she would be that 2%. Then Kim, like I say, with all of the extra weight that she gained too, she also went through a breast reduction and stuff. So, you know, she had to get used to, you know, the way that her body felt and all this other sorts of stuff. But Kim she was a determined girl. I used to always say that she had her mother's determination, her father's stubbornness, but she was going to make herself see. If there was a will, there was a way. And she used to just strain and strain and strain her eyes, you know. And first of all, she started seeing outlines of images. Then she started to see, you know, more detailed. And there, the last year that she was with us, she was reading novels. As long as she had natural light coming over her right shoulder, she would read with her right eye, and she would read novels.
It was a gift.
Yeah.
That's right.
Kim could do Braille. She loved to teach other people Braille and make them feel stupid because they didn't know how to do it, you know. But you know, it was all fun.
Yeah.
But she also hated being labeled blind. She did not want that cane, that white stick. She was not going to take that anywhere. She would rather hold on to your arm and just go for that walk or go do whatever. She also lived by herself 3 different times on her own, because she wasn't going to let her cancer, her blindness, her disabilities, you know, get in the way.
She was an incredibly strong girl. And tomorrow is, well, and I still say it's Kim's birthday, because it is her birthday.
Tomorrow would be her birthday.
And 32 years of age. And yeah,
she passed away when she was 24.
Yeah.
And, you know, there isn't a day that goes by that I don't think about her.
I'm sure.
Yeah.
You know, she'll always be with me. And sometimes, you know, you sit there and think, oh, why did this happen? That's like, oh, Kim, did you do that again? You know, so, you know, it's just, you know, she was an amazing, amazing young woman. And I'm so proud to have had her as my daughter.
It's wonderful.
So you should be.
Yeah.
She was amazing.
So, like I say, you know, she never let, you know, and you see so many people nowadays that, you know, like, okay, they got a broken toe or whatever. And it's like, oh, feel sorry for me, poor me. And then take a look at Kim, and there's so many times I just wanted to boot people in the butt and tell them, you know, like, get a grip. You know?
Well, you must be talking about me, Karen.
I think we all have a little bit of that.
Yeah.
Right.
That is an amazing story. And I know that there's also some miracles that I don't want to give away that are in your book about Kim and about what happened when you went into your backyard, correct?
When I got back from Phoenix, yeah.
Yeah. So I'm going to just let them know that this is a story. You've heard part of the story, and now you've gotten to meet.
Yeah, now you've gotten to know Kim, and there's so much more.
Did you write
There is.
the miracle that happened on the ship?
No, I did not.
So
No.
there are miracles to be told, and maybe she can tell that in another interview. I want people to read that chapter and that story about Kim, because it's so remarkable. Could you say, Meina, just a couple of things to wrap up? I so appreciate getting to know her, especially from her mother's point of view, because I've read her story. What a beautiful family and young woman she was and is, and I can tell the special relationship and how awesome it is that her nurse is now your friend, Karen, and that Meina has you as a friend, because I can tell there's a special bond there. What, though, this was unusual for you as a nurse, and I know in your book you talk about 3 people actually that you got on their dance floor. That was the metaphor that you learned in nursing school, that you were to keep a professional distance, essentially. Right. And Karen, what is it that you do in the medical field?
Unit clerk.
You're a unit
clerk in a nursing home.
Oh, okay.
A lot of
the same
people with cancer, and I see a lot of old people, and I work with a bunch of wonderful people also.
Yeah, and there's that professional way that you're supposed to be with people and such, but you got on the dance floor of 3 different people. We're not going to be able to talk about all of them. We're talking about Kim at this point, but if you could kind of say for nurses or for other people in palliative care who might be watching this about the decision making that you did. I mean, in one sense, this one it looked like officially sanctioned for you to go. Right. Others were not necessarily officially sanctioned. So this didn't have to be as big of an ethical choice for you, I think, or even an emotional choice. Can you just talk very briefly about that and the impact then on you personally, on them? Obviously, you were this amazing support. I can really get it that Karen needed someone like you to know what was going on and to have a personal, intimate relationship, be able to ask you those kinds of questions, how valuable that would be. But what's it like for you as a nurse? What are the dilemmas, the benefits and the drawbacks of that?
Right. Well, I think the benefits, of course, are amazing relationships that continue, and a safe space for all of us to talk about Kim and the others. And because we both experienced that together, certainly I'm not saying that I had, the impact was not as great as it was the family, but it still impacted me.
The loss of Kim, her actual
the loss
death.
of Kim and going to the service. I wasn't Kim's nurse going to the service. I was a grieving family friend. And that is something that you have to realize, that when you step on that dance floor, there's no stepping off again. There is no, well, I'll sit this dance out. There is, you just move onto that dance floor and you're just absorbed in that family's dance. And then you show them some of your own moves, and before you know it, you're dancing together. And I mean, that's great. But I really, you cannot do that with everybody. Because I think it would just have such an emotional impact. But there are some times when you do, and the choices that I made to do that have been a blessing in my life, a teaching experience in my life. And I'm just so grateful that that there is a silver lining in this story, because it continues on.
Yeah.
She will never be forgotten. She won't be forgotten by my family. She certainly won't ever be forgotten by her family. And the amount of people she impacted. She was an incredible girl, incredible warped sense of humor, a twinkle, a crooked little smile, and only gave hugs with permission and never gave a kiss. So that is how I remember her. So,
Do you think that there is any general advice or rule, like if a nurse were to ask you, when do I do this or when do I not? I mean, in this case, I think it was clear. I mean, you could have said, I'm not going to go on this Caribbean cruise with you. I'd rather not, but you were being urged. In the other couple of cases where it might have been more ambiguous, how do you manage that, or what advice? Is there something simple? And it may not be. It's simply a complex kind of a human issue.
It's not an easy thing. It's not.
But it will happen. Maybe that's what there might be. It's going to happen.
Patients will invite you to their home for dinner to show their gratitude.
So do you say yes or no?
And you know what? Those decisions, you have to look inside yourself and whatever you feel comfortable with. I think your intuition will tell you when it's okay to say, that is so gracious of you. But, I just appreciate what I have done to help you. And I get that you want to show your thanks and everything else. And sometimes you have to be a little bit more direct and say, it kind of crosses that line, and it does. But other times you may say, you know what, this feels good, and I'm okay doing that. Yeah. So it's an individual thing. It's not a cut answer. You have to listen to your heart and listen to your mind, and it'll tell you what is good.
And I think one of the things that this book does too, Meina, is give people some ideas about how to make those decisions, and look to mentors such as you, or supervisors, advisors, people that you trust in your life as a nurse, as a palliative caregiver, when you might be in a dilemma situation. Trust your own heart, but if you have questions and such, go to other people and inform yourself as best you can, and then you decide, and then you go on from there.
That's true. Very true. Yeah.
Becky, did you have something to say? Because I know you've been in some ways impacted or know something about this a little bit.
I just feel like what a beautiful, touching story, and you show the true heart. This story, if people listening haven't been touched in their hearts, oh my goodness, I don't know what.
Yeah.
So I just thank you for the heartfelt, and for you, Meina, the decisions to whether to engage or not engage. I know that your intuition and your heart is what tells you the right thing to do. But for both of you to share this gorgeous, beautiful story, what a tribute to Kim. And thank you for sharing that.
Thank you.
And it's so evident that you are friends too. And how much that means, and how great of a support that is for you, how her legacy lives on in your relationship as well.
It's so beautiful.
So thank you, Karen, for taking the time to come and share with us your experience, and the birthday of Kim coming up tomorrow. And I just encourage everyone to read Meina's book, because she has more stories like this that will touch your heart, regardless of whether even you're in the medical field or not. But I am so glad that I got to meet you, especially since I've read your story. It's wonderful to meet you in person, Karen. And thank you for being here. And thank you, Meina, for sharing about your experience and being open about what it really is to be a nurse in oncology and other fields as well. So thank you so much for today. Thank you, Becky, for being here. Thank you, Karen.
Thank you.
And have a wonderful evening tonight, and celebrate this great accomplishment.
Thank you. We will. Thank you.
Enjoy.
Bye-bye.
Thank you.
Bye-bye.